Wellness for Life is brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Ottawa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.
We're back at Mahabi Ottawa today, and joining me today is Loretta Jurdy, and we're going to talk about senior homelessness. And you know, we talk about homelessness quite often, but I think that we don't necessarily think of seniors as having homelessness issues, and you deal with homeless seniors quite often in your role here at Mahabi Ottawa. And over the last couple of years, how many people has that affected in our area? How many people have you worked with?
Well, in the five counties that we serve, I have actually worked with, in the past 3 years, it's going on our third year, up to close to 200 clients.
That's quite a few people.
That is a lot of people.
Mm-hmm. So what are some of the services that you offer for a homeless senior?
So the services that we can provide or help them with is security deposits, first month's rent, housing application assistance, application fees if they have fees, utility deposit assistance, apartment housing searches, also can assist them with filling out the applications as they need. And then there's also the information and referrals to other agencies, and then housing focus case management. So I could follow them for as long as they may need my services.
Sure.
Or may need the help.
So what does that process look like? You know, let's say maybe I've found myself without a place to live, and I contact you. What does the process look like to get started?
Well, the process is very simple. Actually, you just have to call in and talk with me, and we set up an appointment to meet and then do the application intake paperwork, and just a proof of income is all we need.
Are there some particular qualifications to being considered?
Well, the individuals are supposed to be 60 or older. We have worked with some that are 55 plus, but most of the time it's 60 plus. And homeless or at risk of homelessness, or having a housing crisis, where it could be an eviction notice or whatever it might be. And their income has to be 200% of the family poverty level, or the federal poverty level.
So is it oftentimes seniors that are contacting you, or are there family members that are contacting you about their parents or someone that they might know? Can it be anyone that contacts you?
Anyone can contact us, yes, and most of the time it's the senior themselves that has been contacting. I do get some referrals from some of the other agencies, like the county, Lakes Crisis and Resource Center, hospitals, nursing homes, different places.
Sure. I'm curious, once someone goes through the paperwork with you and then qualifies for some assistance, how long does that assistance last? Are you here just to help them get back on their feet? I can't imagine a lot of seniors are out looking for work.
Well, there's a few that still are working, yes. There are a few seniors that still are out there working. I did actually have a gentleman that was 75 years old, and he was still working.
Yeah, I'm just curious, once people fill out the paperwork, do the benefits last for their lifetime, or is there a limit on how long?
Actually, it's just a one-time assistance that we can help them one time per year, as long as we have the grant. And if there's an issue that's happening that they need assistance with, we would see what we could do. We also have other programs at Mahabi that could possibly also assist.
Okay. And you said the qualifications for your program, you need to be, what, 60 years old?
60 or older, homeless, at risk of homelessness, or having a housing crisis.
Sure. So what qualifies as a housing crisis?
Well, an eviction would be one of them.
Okay.
Right off the top of my head, that's what I can think of as the eviction piece. Behind in their rent, possibly. Maybe a month behind in their rent, 2 months, something came up with that they had a crisis that they had to deal with.
Sure.
And couldn't afford to pay all the rent or the rent. We would look at that.
So you're really helping a lot of people in the Mahabi Ottawa area that are dealing with some pretty difficult situations. Where does your funding come from?
Our funding comes from the Department of Human Services, the state of Minnesota grant.
Well, it's certainly something that is happening in the Mahabi Ottawa service area, that there are seniors that find themselves without a place to live or in a housing crisis, like you said, Loretta.
Yes.
And oftentimes I think that this is something that's going on kind of behind the scenes. It's not something that we're necessarily aware of. We don't see it every day. but there are people that are struggling to find a place to live,
Yeah.
and you're here to help them with that.
Yes, that is one of the biggest issues that I've run against is basically the barriers that they may have. Like they may be have been homeless for quite a while, and they may not have landlord references. They may also have poor landlord references or rental history, and also may have a criminal history that we have to deal with and all that kind of stuff. So yeah.
Well, if you're dealing with homelessness, or you know a senior that may be dealing with a housing crisis or homelessness, give Loretta a call or stop into any of the Mojave Ottawa service centers. Thank you so much for your time.
Thank you.
Coming up on Wellness for Life.
Hi, I'm Dr. Mark Wheaton, physician and owner of Lakeside Sports and Pain Clinic with offices in Excelsior, Minnesota and right here in Monaga, Minnesota. Today I'm going to talk to you about a little-known syndrome. It's called Barré-Liu syndrome, otherwise known more technically as posterior cervical sympathetic syndrome. In brief, a syndrome is a collection of symptoms that will, when all put together, can lead to a diagnosis. This particular syndrome, the features of it are symptoms that stem from the neck. And the neck is a very important structure for not only support of the head, but a lot of nerves and arteries and lymphatics run through the area. So what this syndrome is essentially a number of symptoms such as, and it's a long list, ringing in the ears or tinnitus, nasal stuffiness, vertigo, lightheadedness, imbalance trouble, difficulty with speaking sometimes, hoarse voice, ear pain, eye pain, like your eyes being pulled, it can be sinus pain, and a host of others. The list is long. Now, a person doesn't have to have all these symptoms to be diagnosed with Barré-Liu syndrome, but a doctor has to really be familiar with this syndrome if he's going to be able to properly help the patient. And what is often the case is that a person will get these symptoms and they'll naturally go to an ENT if they have ear problems or sinus problems. He'll do a whole bunch of scans and may not come up with anything. Or he'll go to the eye doctor and see if there's something wrong with his eyes, or go to the neurologist and see if there's a problem inside of his head with a tumor or a blood vessel problem. So many specialists are often consulted, and what often happens is that the person comes away from that with nothing abnormal. And the reason for that is that the problem resides in the back of the neck. So right along the neck, or the vertebrae in the neck, are nerves that run along the front of the vertebrae, and they're called autonomic nerves. And when the neck is injured, such as in whiplash or concussion, or just chronically over time from poor posture, and a host of other causes that are sometimes unknown to the patient, this can result in instability, a feature of people that have vertebrae that slightly slip, even a small amount. And when that happens, it puts tension on the cervical sympathetic nerves. And it leads to a disturbance in the transmission of the impulses, giving rise to some of these symptoms that I mentioned previously. So after thousands and thousands of dollars are spent, and except for some rare things that sometimes do need medical treatment for those things, the vast number of these things can be diagnosed by simply examining the neck. X-rays can be used to help see the alignment of the neck, or an MRI, but in most cases a good physical examination will do it. So the treatment for this syndrome is prolotherapy. The reason it is the most effective, and indeed in my opinion the only treatment that helps it permanently, is because the ligaments of the neck are the reason the vertebrae slip. And so prolotherapy uses natural substances to inject into the posterior joint capsules of the facet joints of the neck and the other posterior ligaments of the neck, creating a more stable environment for the vertebrae, causing them to line up better. And when a person goes through a normal movement of their head and neck in their activities or sports or at work, well, the vertebrae then don't slip, putting that tension on the nerves. So this is different from nerves that go into your arm, which can be a pinched nerve from a disc. These are the autonomic nerves, which again rest on the front of the vertebrae. And so this syndrome, when diagnosed properly, can be fully cured with prolotherapy in just a few treatments. So I've utilized prolotherapy for many times on patients with these kinds of symptoms. And so if you have had any kinds of symptoms that seem to add up to a problem that you've had for many years, but you can't figure out why despite good medical assessment, then there's a good chance you might have Barré-Lièvre syndrome. If you have any symptoms that you think might be related to cervical instability causing the symptoms of Barré-Lièvre syndrome as I've described, please don't hesitate to call my office at 952-593-0500 or contact us on the web at drmarkwheaton.com. So you can get out of this problem once and for all if you're properly diagnosed and the treatment of prolotherapy can cure the problem. And I recommend that you highly get in to see me or someone who's familiar with the syndrome and get the problem solved once and for all. Thank you.
Thank you for watching Wellness for Life. Brought to you by Back in Motion Physical Therapy, Gothenburg Chiropractic Clinic, Mahabi Atwa Community Action Partnership, Natural Alternatives, and Lakeside Sports and Pain Clinic.